Okay, so this is Erin's PRP, or her Platelet Rich Plasma. So we've done a simple blood draw for her and processed the blood. And the reason we want to isolate these platelets is because they contain growth factors and stem cells that are just going to make our treatment for her even more effective. There are different additives we can add that accelerate the healthy cells that we want to use for this treatment. And anyway, so I'm going to go ahead and get this processed for her treatment, and we'll show you what that looks like. All right, the treatment. So Erin has been numbed, her face is clean, we've processed her blood draw, so she's ready for her treatment. Now she's beautiful. So this treatment for her is really going to be about prevention. And then also she does have some hyperpigmentation just from sun and some freckling, and this treatment is going to help brighten her skin. So I'm going to use a serum for her today. It's Eminence, it's Bright Skin, and it does help fade all of those dark spots. So that's the first thing I'm going to put on her skin. And then we're going to start microneedling. And this is the SkinPen. It's a medical device for microneedling. It has a disposable tip with little stainless steel needles that are going to make microchannels in her skin. It's very comfortable with the numbing cream, and then those little microchannels elicit a healing response, which helps tighten the skin, brighten, actually thicken it up a little, reduces fine lines, and all the signs of aging. This pen is brand new. It's the only FDA approved microneedling device in the United States at this time, so we're really excited to have this in our practice. So this is going to be a little noisy. The forehead is the most sensitive area just because the skin's thin and there's not a lot of tissue here, so I do that first to get it over with. So with my first pass, I'm just making that first set of microchannels. How do you feel there?
I don't feel it.
Okay, good. So I know I can go a little deeper with my needle depth for her. And now I'm going to put PRP on. I'm just topically applying this, and we're going to drive it in with the microneedling device. And these channels on the skin are open for 20 minutes. That's when we want to get all these good products in there. So this treatment can be used to decrease large pores. It's great for acne scars, stretch marks, sun damage, hyperpigmentation. It's a safe treatment for melasma since it doesn't use any heat. It's safe for pretty much every skin type. If someone keloid scars, we would do a test spot first. And it can be done in summer and winter, so it's not one of those treatments like a chemical peel that you can only do when the weather's cool. This treatment will only take about 20 minutes. It's going to have very minimal downtime, so Erin's just going to avoid the gym for 24 hours. I'm going to give her the aftercare products she's going to use for the next 48, and then she can just go about her routine as usual. We do recommend a series of 3. This is also known as the vampire facial, so microneedling with PRP. If you saw the Kim Kardashian video of her vampire facial, she was crying and in pain, but that is because she didn't use any numbing. She was pregnant at the time, so she wasn't able to use the topical numbing, and I think there was a little drama involved in that video as well. Plus, they used the red blood cells also, which made her look very bloody. And red blood cells don't add anything to this treatment at all, and they actually can sting a little. They're actually, more of a waste product for what we're wanting to do. So you don't need to come out looking like Kim K did when you have your vampire facial. Good. All right, does that hurt? All right. So you might see that the pen has a little bit of drag up here. And what it's actually doing is it's hitting tissue that's a little thicker. So scarred areas like acne scars will actually slow the pen down, and it adjusts RPMs so that you get an even treatment on that skin. where the pens we used in the past just kind of dragged across scar tissue. So I'm seeing just beautiful results for acne scarring with this treatment. The cheeks usually you can't feel at all, and you can do a pretty deep treatment there.
It actually feels good.
Yeah?
It doesn't feel bad at all.
My partner says my partner says it feels like a giant cat is licking her.
Yeah, maybe with her scratchy tongue.
With the scratchy tongue,
yeah.
But not painful, right?
No.
So this has adjustments for needle depth, so I'm watching how her skin responds to decide what needle depth I'm using in which area. Another nice thing about this treatment versus lasers is that I can get very close to her eyes and get some of the dark circle area, and there's even like a little brow lift treatment we can do with this.
I feel like I need that.
We all need that.
Yeah.
All right, so as long, I'm gonna go ahead and pull your skin down here. So as long as I'm going on the bone, I can just retract the skin down and get very close to her lower lashes. And same here under her brow. So that's not possible with most of our laser treatments, being that close to the eye. Okay. So Erin's skin type, you can see she's dark complected, and she's a type 4. I would classify her as a type 4 Fitzpatrick skin type, which means she's not really a good laser candidate for things like IPL. Her skin tone is too dark, so her melanocytes will target the laser light and she'll be at risk for burns. And then also, she hyperpigments very easily. So a treatment for her could actually leave her with more spots than she has as a post-inflammatory reaction. I have similar skin, so this is a perfect solution.
What's the difference about doing this with the PRP and not the PRP?
Right. So you can still get a good treatment doing microneedling without PRP. You're still going to have the microchannels and healing response. The PRP just ups everything. So utilizing your own stem cells and growth factors gives us more healing benefits. I also really like it for people that are sensitive because you're not going to react to your own blood cells. You know, where you might have skin reactions to other serums or things that we would microneedle. Now she's going to be a little bit more red tomorrow in the areas that I'm double passing. And areas that I double pass pretty much for all women are the chin, where we can get the cobblestone chin or that little crease right there. Also nasolabial folds, usually double pass around the eyes. All good prevention. There's the nasolabial fold area. So what Erin's going to experience is she's going to look kind of rosy and red, like she has a sunburn or a windburn. For her, it'll probably only be about 24 hours. For lighter complected people, it can be 72. She might get a little bit of peeling, but it's going to be more just little flaky, feathery peeling than what we see with a chemical peel. So it won't be peeling like in sheets like a snake. And then after about a week, her skin's just going to be glowing and look beautiful. And then the effects of this treatment are going to continue for 2 months. She'll be building new collagen. So her skin's just going to look better and better. And then we like to do, I think I said 3 treatments, and we do them about a month apart, just to keep building on that collagen stimulation. This is really great for any straw lines, fine lines above the lips. I know she's not a smoker, so hers wouldn't be smoker's lines. I'm seeing a lot more lip lines on young people from vaping, by the way, and Starbucks straws. You can purchase stem cells and growth factors, and they're basically processed the same way organs are for transplant, and the stem cells usually come from 21-year-old healthy males because they have what everybody wants. There's some controversy there. Some people think it's not as effective, but I have used them on people that are terrified of blood draws. So there is that option.
Me? It was good. Yeah, she did an awesome job, and it wasn't painful at all.